Good evening. This is All India Radio, Kohima. I'm Jonas Yantan with Evening News. The headlines. Centre provides over 23 crore vaccine doses to states and union territories so far. Today is World No Tobacco Day. Union Health Minister Dr. Vardhan takes pledge to keep away from tobacco. A Nodal Officer for Dimapur district, Kikheto Sema, asserts that COVID-positive death rate in Dimapur continues to remain high at 4.11%. As the number of COVID cases are on the rise, we appeal to our listeners not to lower the guard, follow all the precautions, and all those above 45 years who have taken the first dose of COVID-19 vaccine to get vaccinated with the second dose at a scheduled time. Stay safe and protected by following these three simple steps. Wear a face mask, focus on hand and face hygiene, and maintain a distance of 2 yards for social distancing. National and state helplines are operational for providing COVID-related information and guidance to the people. National helpline numbers are 011-2397-8046 and 1075, while the state helpline numbers are 700-5539-653 or 1800-345-0019. Now the news in detail. The centre has provided over 23 crore vaccine doses to the states and union territories free of cost so far. Of this, the total consumption including wastages is over 21 crore doses. More than 1.75 crore COVID vaccine doses are still available with the states and union territories. Further, over 2.73 lakh vaccine doses are in the pipeline and will be provided to the states and union territories within the next 3 days. Today is World No Tobacco Day. The theme for this year's World No Tobacco Day is Commit to Quit. The yearly celebration informs the public on the dangers of using tobacco, the business practices of tobacco companies, what WHO is doing to fight the tobacco epidemic, and what people around the world can do to claim their right to health and healthy living and to protect future generations. Union Health Minister Dr. Vardhan today took pledge to give away from tobacco on World No Tobacco Day 2021. Chairing an event to mark the occasion, the minister said in India over 1.3 million deaths are attributable to tobacco use every year, amounting to 3,500 deaths per day. He said in addition to the death and diseases it causes, tobacco also impacts the economic development of the country. He also pointed out that smokers face a 40 to 50% higher risk of developing severe disease and death from COVID-19. Dr. Vardhan said, due to persistent efforts of the central government and state governments, prevalence of tobacco use has decreased by 6% from 34.6% in 2009-10 to 28.6% in 2016-17. Speaking on the staunch political commitment of the government in curbing tobacco use, Health Minister lauded Prime Minister Narendra Modi's efforts in passing the Prohibition of Electronic Cigarettes Bill 2019, which prohibits production, manufacture, import, export, transport, sale, distribution, storage, and advertisement of e-cigarettes. This news comes to you from All India Radio, Kohima. You can also listen to this news bulletin on our YouTube channel, AIR News Kohima. The death rate of COVID positive in Dimapur continues to be high at 4.11% since January 2021 deal date. This was informed by Nodal Officer for Dimapur District Kikheto Sema during a press conference held today at the DC Conference Hall in Dimapur in the presence of Deputy Commissioner, Commissioner of Police and Chief Medical Officer. Kikheto said vaccinated death rate is 5.14%, mostly with comorbidities, whereas non-vaccinated death rate stands at 94.86%. He said deaths in the age group of 30 and above comprise of 96.70%. While highlighting on the status of COVID facilities, Kikheto said the district has about 375 COVID beds in government and private hospitals. He said in less than 3 weeks' time, Team Dimapur could create 285 COVID extra beds. While 110 COVID beds are also being set up at the Institute of Hotel Management in New Purana Bazaar, Dimapur, he added. He appreciated the private hospitals and private doctors association for coming to the rescue in this fight against the pandemic. Kikheto also stated that in order to enable the public know the status of hospitals, a website, Team Dimapur COVID.com, has been developed and launched. Kikheto further said PSA oxygen plant at district hospital became functional with effect from 25th May after receiving certification. As a sigh of relief to many COVID patients in the district, Muguchung Town Baptist Church (MTPA) has decided to start a community kitchen at the revived COVID care center Marepkong at Muguchung from tomorrow. Speaking to AIR News Kohima correspondent exclusively today, Pastor MTPA Reverend Ponen Longcha disclosed that the church has come up with a decision to manage at the center after witnessing asymptomatic corona-positive patients being sent home to isolate. The pastor observed that this leaves a high chance for further spread and infection of the virus due to the fact that majority of the households share common toilets besides facing practical problems during home isolation. Therefore, the church approached the district administration for revival of the COVID care center with the MTPA offering to run the kitchen. The pastor also apprised that besides running the kitchen, the church will offer morning and evening devotion to the inpatients at the center, besides giving counseling and prayers to those positive patients through phone. The pastor further added that the kitchen will be manned by the members of the youth department of the church. While preparations are in full swing for setting up the kitchen at COVID Care Center Marepkong, other pastors and members of the church were seen preparing a welcome kit to be distributed at the center tomorrow that included toiletries, cups, spoons, plates, and a Bible. Besides, to further extend the support to the community during these difficult times, Muguchung Town Baptist Church has taken up measures to provide services to those in need, such as 24/7 care and counseling for COVID positive. It may be noted that the COVID care center at Marepkong, Muguchung, was in operation till last year during the first wave of COVID-19. Founder and Principal Emeritus of Tetso College, Dimapur, Dr. P.S. Lorin, passed away this morning at Eden Medical Center, Dimapur. He was 68. Chief Minister Nipirio, in a condolence message, said, in his demise, Naga society has lost a fatherly figure, a mentor, guide, and a true son of the soil. He said Dr. Lorin was not only a par excellence educationist, but also a social activist who had sincere concerns for the welfare of the society. He said a vacuum created will be difficult to fill, saying that it would be befitting that we continue the legacy of public service that he has left behind so that he will continue to live among us. Advisor R. King also expressed pain at the demise of Dr. Lorin and said he was an educationist par excellence, a humble soul and a forthright person who stood for the truth. His immense contribution in the field of education and social cause for the Nagas will be fondly remembered, King added. Meanwhile, the State Department of Higher Education has also expressed grief at the sudden demise of Dr. P.S. Lorin. A condolence message from the director, Dr. Abeni Lotha, termed Dr. Lorin as a transformational leader for higher education institutions in the state. Dr. Abeni said, in his demise, the state has lost a prominent leader of education. And now to end the news, here are the main points again. Centre provides over 23 crore vaccine doses to states and union territories so far. Today is World No Tobacco Day. Union Health Minister Dr. Harsh Vardhan takes a pledge to keep away from tobacco. A Nodal Officer for Dimapur District, Kikheto Sema, asserts that COVID-positive death rate in Dimapur continues to remain high at 4.11%. That is all we have in this evening news bulletin. Good night.